Hi everyone, I'm Diana, and today my group and I are going to give you a brief overview of general personality disorders. General personality disorder is a mental disorder that manifests as impairment in at least two of the following areas: cognition, affectivity, interpersonal functioning, and impulse control. Typically, these behaviors can be maladaptive, which can affect the person's relationships in everyday life. This disorder is common. It is stated that it occurs in 10 to 20% of the general population, and over 50% of psychiatric patients are diagnosed with a type of personality disorder. Also, personality disorder is chronic and can be considered as a risk factor for other types of mental disorders such as anxiety disorder, eating disorders, and impulse control disorders. Personality disorder is considered an umbrella term because there are 10 subtypes that fall under the disorder itself, and is classified in 3 different clusters. Cluster A encompasses 3 personality disorders, which are schizotypal, schizoid, and paranoid. Cluster B includes 4 personality disorders, and these are narcissistic, borderline, antisocial, and histrionic. Cluster C includes 3 personality disorders: obsessive-compulsive, dependent, and avoidant. Individuals diagnosed with personality disorder cannot associate their behaviors as maladaptive, and they deny any problems in their life. Moreover, they are more likely not to seek any psychiatric help and are unconcerned with any treatment. Now, Elsa is going to discuss potential assessments and practice settings.
Hi, Elsa here. The DSM-5 provides criteria to help diagnose personality disorders, but using the DSM-5 alone can often lead to overlapping, mixed, or incorrect diagnoses. Often, clinicians complete additional assessments to help identify the correct mental health disorder. The Schedule for Non-Adaptive and Adaptive Personality, known as SNAP, which is a self-reporting questionnaire for the assessment of personality disorders, assesses maladaptive personality. These constructs include mistrust, self-harm, eccentric perceptions, aggression, manipulativeness, entitlement, detachment, exhibitionism, dependency, workaholism, and more. Another assessment that can be used is called the Dimensional Assessment of Personality Pathology Basic Questionnaire, or the DAP-BQ. And this is designed to assess and help treat personality disorders along the full continuum, from mild to extreme trait manifestations. This dimensional model helps increase accuracy in diagnosis as it provides an enhanced understanding of behaviors and symptoms, reducing diagnostic overlap. These results not only help clinicians understand, classify, and treat personality disorders, but also facilitate treatment using adaptive personality traits for a balanced approach. Results also help individuals with personality disorders understand their behavior, link past events, identify recurring patterns, and anticipate problems. When a person with a personality disorder poses an imminent risk to themselves or others, they can be sectioned to an acute care psychiatric unit within a hospital. This means that they are brought and kept in a hospital against their will until they are deemed to be safe enough to go back into the community. Adolescents presenting with early onset personality disorders are often not able to be successful in their home environment and require additional structure, routine, and support to manage their symptoms, and often live in a residential program. Because of the stark contrast between societal norms and the behavior of those with personality disorders, often individuals with personality disorders end up in a prison. Now, Kate is going to discuss OT and group interventions.
Hey guys, it's Kate. One example of an OT treatment that falls beneath the Model of Human Occupation Framework, also known as MOHO, is a role checklist. The role checklist can help understand the impact of this disorder on the person's ability to engage in their roles that they actually find meaningful. Examples of roles that are demonstrated in this checklist include student, worker, volunteer, caregiver, home maintainer, friend, family member, religious participant, hobbyist or amateur, and participant in organizations. There is also an other category where individuals can enter additional roles not listed. Another example of an OT treatment that falls beneath the psychodynamic approach includes goal writing. Goal writing is a beneficial intervention in regards to problem solving. This allows the client to structure their life choices in regards to social and interpersonal relationships. An example of this may be, what is one quality about yourself you would like to improve or change by next year? There are also various group treatments that are appropriate for interventions for individuals with personality disorders that include coping skills, dialectical behavioral therapy, also known as DBT, and role play. Coping skills assist the client in finding adequate strategies in order to better adapt to their disorder. DBT involves 4 components that include skills training groups, individual psychotherapy, telephone consultation, and a therapist consultation team. DBT includes multiple means of participation that can be demonstrated within a group atmosphere. Role playing includes putting the individual in a simulated situation in order to anticipate how they may act in a real life situation. Now Jess is going to talk a little bit about the evidence-based practice articles we used in order to prepare this information on general personality disorders.
Hi, this is Jess. One of the 2 articles we read was called How Do Professionals Experience Working with Offenders Diagnosed with Personality Disorders Within a Prison Environment? So within this article, it talked about how occupational therapists can work with people diagnosed with personality disorder in a prison setting, and that it's extremely important for the therapist to not have any negative attitudes towards the client because that impacts the quality of care provided. People with this diagnosis can feel marginalized from society, which can even worsen when they're in a prison setting because they're being marginalized more. Semi-structured interviews were conducted with 14 clients who were in a high-security prison. The main themes in the interview were the prison environment, synergy of the workforce, understanding of the client, and support the clients have been given. In the second article, that was entitled Experience of Occupations Among People Living with a Personality Disorder. This was an exploratory study that focused on people diagnosed with personality disorder and how they fulfill their main occupations. Results from this study explain that these individuals who fulfilled their occupations were occupations that were socially disapproved and used as a coping strategy to deal with de-stressing situations. An important aspect from this article was that the participants noted that they perceived self-care occupations and important chores as meaningless occupations. That can be an example of maladaptive behaviors and affecting everyday life, which are characteristics of personality disorders. Hopefully, now you have a greater understanding of general personality disorders, along with how to assess and treat individuals with these diagnoses. Thank you for listening.